Chapter 15. Blood. Full blood account. In the investigation of blood diseases, the simplest test is a full blood account (FBC). A full blood account measures the following in a sample of blood: the amount of hemoglobin, the number of the different cells, red blood cells, erythrocytes, with white blood cells, leukocytes, and platelets, thrombocytes. The volume of the cells, the erythrocyte sedimentation rate, ESR, measurement of how quickly red blood cells fall to the bottom of a sample of blood. Anemia. Anemia is one of the commonest diseases of the blood. It may be due to bleeding, loss of blood, excessive destruction of red cells, low production, for example, because indeed is lacking of deficient in iron. A medical student has examined an elderly patient with a very low level of hemoglobin and is discussing his case with her professor. Professor, what's the most likely diagnosis in this case? A student, most probably carcinoma of the bowel with chronic blood loss. Professor, what's against that as a diagnosis? A student, well, he hasn't had any change in his bowel habit or lost weight. Professor, what else would you include in the differential diagnosis of severe anemia in a man of this age? A student, he might have leukemia of some sort, plastic anemia, but that's rare. It will be very unusual. Another case is iron deficiency, but he seems to have an adequate diet. Professor, okay, now there's another case of anemia which I think is more likely. A student, chronic bleeding ulcer. Professor, yes, that's right, but what about pernicious anemia? Can you exclude that? A student, well, he got none of the typical neurological symptoms like paresthesia. Pernicious anemia. Jordi Pons, the medical student from Barcelona, has made some language note in his textbook, pernicious anemia is a condition in which there is atrophy of the gastric mucosa with consequent failure of intrinsic factor producing and vitamin B12 malabsorption. To the onset is insidious, insidious with progressively increasing symptoms of anemia. Patients are sometimes said to have a lemon yellow color owing to a combination of pallor and mild jaundice caused by excessive breakdown of hemoglobin because of ineffective red cell production in the bone marrow. A red sore tongue glossitis is sometimes present. Patients present with symmetrical paresthesia in the fingers and toes, early loss of vibration sense, and progressive weakness and ataxia. The spleen may be palpable. Onset, beginning, insidious, slowly developing, pallor, lack of color, mild, slight, um, jaundice, bilirubin, breakdown, division into smaller parts, bone marrow, soft tissue in the cavity of bones, symmetrical, each side the sum, vibration sense, ability to feel vibrations. Progressive, continue to develop, palpable, can be felt with the hand.